Hello, how are you all? I just wanted to make this quick video on clinical practice 1 because I feel like it's going to help a lot of you as you get ready to begin your clinicals. You know, clinicals is like a whole new part to the nurse practitioner program, which for a lot of us we are not used to. So it's going to be like your first day and you're wondering what can I do and what do I need to get. So we're going to go ahead and get started. Please subscribe to the channel, and also I'm going to be putting some links below at the end of this presentation in the description section for some of the products and things you will need for clinicals. That way you can click on those links and it will be able to take you to the Amazon site for you to be able to buy them if you don't already have some of those. So for CP1 materials, some of the things you should gather to get ready for clinicals would include your stethoscope, obviously a white coat depending on which clinic or hospital you are in. Let me say if you go and your preceptor is in scrubs, then maybe you do not need to wear a white coat, but if your preceptor wears a white coat, then I feel like it might be nice for you to also have your white coat. Also, you will need your school ID, and this is when you are also going to need a lot of the instruments that were used in your health assessment class, like your otoscope or your mask. Now that there is COVID, obviously if you're going to the clinical setting, you're going to also need a mask. So for day one, obviously you're going to be very nervous. You're going to be meeting your preceptor, seeing patients for the very first time. So, but some of the things you also want to get ready when you're going is to print out your preceptor's sign-off sheet, which will be given to you by your school for your hours verification. So depending on your school or what they might need. But for my school, we needed to print out our preceptor sign-off sheet and fill it out with our information. So each day you're in clinicals, you get your preceptor to sign it at the end of the day. And they want you to get that signed every day when you're in clinicals. You also definitely want to make sure you arrive on time, especially on your first day. And also, you need to get some resources to look up information. So some helpful resources which I have used, and also some of my friends in school, include resources like UpToDate, Hippocrates, 5-minute clinical consult, the Holier review book. It has a clinical guideline in primary care, and then you can also download the CDC immunization app, especially if you're going to be going to pediatrics, but you also need it for your sub notes when you do your health promotion sections. So the CDC immunization app is good to have. Also maybe downloading the USPTF task force app, and also the ASCVD risk calculator. Also, one thing which I did and a lot of my friends did when we were starting clinicals was obviously maybe upgrading your phone to one that is going to be able to hold all of these apps that you might need. But if you have a good phone with a lot of memory, then you're good to go. But for me personally, I use Hippocrates because it was a little bit cheaper than UpToDate, and also I had my Holier review book, and then I downloaded all of these apps. So for the course breakdown for clinical practice 1, obviously you need 180 hours, and this 180 hours can be in pediatrics, it can be in family or internal medicine or geriatrics or women's health. You cannot do urgent care in clinical practice 1 or retail health clinics. You are going to need a minimum of 180 hours and a minimum of 180 patients. So for like the course breakdown, you're basically going to need there are a total of 4 quizzes with about 10 questions each, and I think about 2 discussion boards. I'm not quite sure about this one, I don't remember it quite well. You're going to need 2 sub notes on an acute medical problem, and also there's a sub note after your final checkoff. There's going to be a 1 midterm checkoff, which is basically like you presenting patient to your instructor, and then telling the instructor how you're going to manage the patient. For the midterm checkup, when I took the class, there was no, you didn't need an actual patient. So you just kind of read the scenario and then you present that patient to your instructor. So definitely before your midterm checkup, since it was a huge part of the grade, you want to make sure you research everything that the patient is going to need, including like health promotion, smoking cessation, immunization, screenings. So don't forget those parts when you do your presentation. And then also for the final checkup, you're going to need a live patient for this one. So make sure you have somebody who is going to volunteer for you to be able to do your assessment on them. And when you're done with your final checkup, they give you 1 hour to submit your sub note. So you have to be ready to get that done. For me, I kind of pre-filled some of the parts of the sub note such that when I went and immediately after the checkup, it was just easy for me to go. So thank you all, and I hope this was helpful to just kind of get your mind prepared for what you're going to be facing in clinical practice 1. I also have some links here to Amazon to some of the materials that I've mentioned that you're going to need. Obviously, for instance, like the Holia review book if you didn't buy it in FNP 1, and also the 5-minute clinical consult. My preceptor told me about that one. It was really good. It's also really good. And also I'm going to put a link in the description section of this video where you can click on and see some of these items that you can buy off of Amazon. And also I have like stethoscope and those type of things. So you definitely need a good stethoscope so you'll be able to hear those murmurs and those and the sounds, because you don't want a very cheap stethoscope. Now you're going to be a provider, so you need to be able to diagnose those problems. So you need a very good stethoscope. Thank you. Please do not forget to subscribe to the channel. If you have any questions, you can leave it in the comment section below, and I'll be willing to answer any questions that you may have. Thank you.